I really appreciate all the calling ophthalmologists for having me here today. My name is Yuichi Hori, and I'm a professor of Department of Ophthalmology at Toho University Faculty of Medicine. I will share with you the findings on Alesion Lx, a new epinephrine eye drop for the treatment of allergic conjunctivitis. First, I will give you a brief overview of allergic conjunctivitis. According to recent studies, allergic conjunctivitis affects 8.4% of Korea's population, particularly younger adults who may be more exposed to environmental allergens and pollutants. Two most common subtypes of allergic conjunctivitis are seasonal allergic conjunctivitis, or SAC, and perennial allergic conjunctivitis, or PSC, both in Western and Eastern countries. The prevalence of allergic conjunctivitis is increasing globally and linked to changes in environmental and lifestyle factors. In environment, climate change, such as global warming, and air pollution, such as PM2.5, are reported to be linked to increase in allergic conjunctivitis. Moreover, in lifestyle, cosmetics, contact lenses, digital screen may be linked to increase in allergic conjunctivitis. As you know, dry eye is also linked to change in lifestyle factors. In systematic review and meta-analysis, up to 47% of patients with allergic conjunctivitis suffer from dry eye. Dry eye impacts allergic conjunctivitis by reducing tear volume. Tear film can prevent allergic antigen from contact with the ocular surface and remove them. Furthermore, ocular allergies can impact on several key mechanisms of the dry eye vicious cycle, including tear film instability and hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormalities. This slide shows a case with allergic conjunctivitis and dry eye. This kind of patients need treatment of allergy and dry eye. In 2021, Japanese Ophthalmological Society launched the Clinical Practice Guideline for Allergic Conjunctival Diseases. In this guideline, allergic conjunctival diseases are classified into 4 diseases, including allergic conjunctivitis, atopic keratoconjunctivitis, vernal keratoconjunctivitis, and giant papillary conjunctivitis. Allergic conjunctivitis can be divided into SAC and PSC. Allergic conjunctivitis results from an immune response to external allergens such as pollen or dust. The immune response triggers mast cells to release histamine, which causes redness, itching, and swelling in the conjunctiva. In severe case, these symptoms may become chronic, causing ocular surface damage. This allergic response can be divided into an early phase, marked by histamine release, and the late phase, where chronic inflammation can develop. Effective treatment must target both these phases to provide a comprehensive symptom relief. In managing allergic conjunctivitis, a patient-first approach is essential. Our goal is to not only reduce symptoms, but to address all the conditions on the patient's daily life. First of all, a non-pharmacological approach are very important, including indoors to keep windows closed, to keep animals outside or limiting pet access, and to wash bed covers and vacuum regularly. In outdoors, to wear sunglasses or a goggle outside, monitor seasonal pollen counts, and wash hands and clothes after being outdoors. As self-care, to avoid eye rubbing, to use a cool compress on the eye, to use artificial tears without preservatives to wash allergens from the tear film, to wash hands or clothes after touching animals, and to avoid contact lens wear. After self-care, we will need to use drug treatment, but there are some limitations. For example, topical vasoconstrictors have limited efficacy and can lead to side effects, including rebound hyperemia. Oral antihistamines can have anticholinergic effects, for example, dry eye. Topical antihistamines are only useful to treat acute phase. Mast cell stabilizers are not effective once the patient is asymptomatic. And problems by preservatives, for example, VAK. Next, I will talk about the new epinephrine eye drop, Alesion Lx. In 2024, Santé Pharmaceutical launched Alesion Lx, containing epinephrine 0.1% for treatment of allergic conjunctivitis. This newest eye drop offers dual-action relief by blocking histamine receptors and stabilizing mast cells. The histamine receptor blockade works on H1 receptors, reducing immediate symptoms like itching, while mast cell stabilization prevents the release of further histamines, reducing the possibility of subsequent reactions. This combined approach provides both immediate relief and sustained control, addressing the patient's needs throughout the day. Clinical studies have demonstrated the rapid efficacy of Alesion Lx. In clinical trials, patients reported symptoms relief within minutes, with a duration of action lasting up to 8 hours. This duration allows for fewer applications throughout the day, which improves patient convenience and compliance. Additionally, long-lasting relief is particularly valuable during peak allergy season, when patients experience more intense symptoms. This dual action also supports use in both seasonal and perennial allergic conjunctivitis cases. As you know, oropatazine is also a popular treatment for allergic conjunctivitis. I will show you some comparison data with oropatazine. Epinephrine has an inverse agonist activity, which can be proposed as an important factor influencing the effects of pre-seasonal therapy. Oropatazine also has an inverse agonist activity. However, epinephrine has stronger inverse agonist activity than oropatazine. Furthermore, studies indicate that epinestine has minimal impact on tear volume, making it less likely to severe dry eye symptoms. This is crucial for patients who already struggle with dry eye or who are frequent contact lens wearers. Next, I will talk about the safety and tolerability of epinestine 0.1%. Alesion Lx is preservative-free, which enhances its safety and tolerability profile. Preservatives are known to cause irritation, especially in patients who need frequent applications or have sensitive eyes. In clinical studies, Alesion Lx showed minimal side effects, with most patients experiencing only mild temporary irritation, if any. This preservative-free formula is well suited for long-term use, which is very important for patients who have year-round symptoms. Let me summarize the efficacy of Alesion Lx. Alesion Lx provides a comprehensive solution for managing allergic conjunctivitis. Its dual action mechanism, high receptor affinity, and preservative-free formula address the diverse needs for patients today. Epinestine may be suitable to recommend the wide range of patients with allergic conjunctivitis, including patients over 12 years of age and adults with seasonal and/or perennial allergic conjunctivitis. Patients sensitive to preservatives. Patients who experience dry eyes. For example, computer users, post-LASIK, post-menopausal. Patients who wear contact lenses, and patients who require short-term and/or long-term management. Actually, in Japan, Alesion Lx, epinestine 0.1%, is the most commonly used treatment for allergic conjunctivitis. I am very happy that Korean patients will also be able to experience the benefits of this eye drop. Thank you very much for listening. In this part, I will discuss head conjunctive disease that frequently occur in patients with atopic dermatitis. Atopic dermatitis, or AD, includes various conditions such as atopic keratoconjunctivitis, atopic blepharitis, keratoconus, atopic cataracts, and even more severe issues like glaucoma or retinal detachment. Today, I will talk about the atopic keratoconjunctivitis, or AKC. In Japanese clinical practice guideline for allergic conjunctival disease, or ACD, this term was defined as a spectrum of inflammatory conjunctival diseases triggered mainly by type 1 allergic reactions, with subjective and objective findings elicited by antigens. Allergic conjunctival diseases are classified into 4 diseases. In this presentation, I would like to share the case with AKC and VKC. AKC is a chronic allergic condition often linked to patients with a facial atopic dermatitis. Clinically, it may improve conjunctive fibrosis, corneal neovascularization, and corneal opacity. For treatment, anti-allergic eye drops are a first-line option. If they fail, we escalate to immunosuppressive or steroid eye drops, often in collaboration with internal medicine or dermatology specialists for systemic management. Recently, IL-4 receptor alpha chain antibody treatment become more popular. Vernal keratoconjunctivitis, or VKC, typically presents during childhood and involves proliferative changes in the conjunctiva, such as papillary proliferation and trunks plaques. Severe cases can lead to corneal complications like sealed ulcers or plaques. First-line treatment for VKC is anti-allergic eye drops, followed by immunosuppressive or steroids, depending on severity. House dust and mites are common allergens associated with this condition. For allergic conjunctival diseases overall, anti-allergic eye drops remain the mainstay of treatment. In Japan, epinephrine 0.1% is widely used due to its effectiveness and safety profile. And it is benzaquinine chloride-free and requires fewer daily applications. For cases resistant to initial therapy, immunosuppressive is the second choice, and steroid therapies are third line. This slide shows a case with allergic conjunctivitis and dry eye. This kind of patients need treatment of allergy and dry eye. This slide shows a case example for a 9-year-old boy with VKC. Despite initial treatment, he required tacrolimus and 0.02% fluoromethanol to control his symptom over 2.5 years. This case highlights the importance of customizing therapy based on disease severity and patient needs. In conclusion, allergic conjunctival diseases in patients with atopic dermatitis and can become challenging conditions. Early diagnosis and tailored treatment are crucial to prevent complications and maintain quality of life. I believe that it is important to find an effective combination treatment of epinephrine and steroid, or epinephrine and immunosuppressive for each patient. Thank you very much for kind attention.日本では、アレジオン LX は2回、点眼になります。一方、オロパタジンの点眼は1日4回になりますので、やはり、ほとんどの日本の、眼科医はアレジオン LX を選択します。また、アレジオン LX はプリザーバティブフリー、ですので、アレジオン LX を選択することが多いです。ありがとうございます。ご質問ありがとうございます。日本ではあまりアレジオン LX で、ドライアイが悪くなる、という経験はありません。ですので、ドライアイの患者さんにも安心してアレジオン LX を使用しています。ご質問ありがとうございました。 ありがとうございます。ご質問ありがとうございます。日本では、花粉の飛散、花粉が飛ぶ前のだいたい2週間から4週間前から、予防的に、アレジオン LX を投与することが、推奨されていて、多くの、先生がそのように行っています。通年性の、アレルギー性結膜炎の場合は、もう、通年でずっとさせてもらうということになります。ご質問ありがとうございました。はい、ご質問ありがとうございます。やはり、症状があってから指すのではなく、症状がなくても、ルーティンリーに、目薬を指すということが非常に大事、と思います。まずは、花粉症の場合は花粉の前の、数週間前から、予防的に使用して、で、痒くなったり、症状がなくても、アレジオン LX の場合は朝と晩に1日2回、投与する、ことが、重要かと考えます。ありがとうございます。